Hey everybody, I'm Marlon from Chronic Pain Warriors United. Welcome to the channel. Hope y'all are all having a great beginning of the week. It's just a beautiful sunny Monday here in Birmingham, Alabama. I'm just looking out the window. So a couple days ago, I released a short on situational depression. And today we're going to talk more about that as well as self-isolation, because they're both things that I'm dealing with personally right now. And I think it's fair to say that pretty much everybody who contends with chronic pain and illness will at some point deal with either general and or situational depression and self-isolation. Probably all three, really. So I just have a few bullet points we're going to go through real quick on self-isolation, why it happens, and the difference between your partner or loved one dealing with these issues, needing their own space and just needing their own time alone, which we definitely do at some points. And then when their other mental health issues are going on and they may need to be reached out to. There is a difference between the two, and I just kind of want to talk about them both today. So with self-isolation, we do this for all kinds of reasons, but they're all sort of in the same box, if that makes any sense. So just to start off with, chronic pain and illness can limit mobility and functioning. Small things and events can take large amounts of energy from us. So this is an issue that we've talked about before, and it's just like before we were injured or before whatever illness we deal with came along, we were able to do things that we're not going to be able to do anymore. And then when we do things, it requires or takes a lot more energy from us to do it than it would have before, and than it does from normal, healthy people, right? I mean, our energy bar goes down very quick. And that's one reason that we can sort of self-isolate, is because we just don't want to deal with it. We don't want to deal with whatever events going on or whatever group of people may want to see us or hang out. I mean, it's so draining at times that we just don't want to deal with it. And then on top of that, having to have the conversation for 150th time about why you can't do something, why you can't do this or why you can't do that. And that's something that I myself over the last 10 years have had a really hard time with. I hate those conversations at this point. I've gotten to a point where I don't even really do it anymore, except for things like this. In my general life, I don't offer explanations to people anymore unless they're very close to me and I feel like they deserve one, really. Deserve is kind of the word. But if that's not the case, then no. That extra amount of time and energy to explain that again is just not worth it. And so that limits, how much contact we have with other people. And then we isolate ourselves, obviously, due to not feeling connected and it being very difficult to connect a lot of times to the people around us. Being frustrated that most of our loved ones, partners, or friends don't really understand us and don't know where we're coming from, and making our issues small, like I've said in many of these videos. And so we just get tired of it. We don't want to have the conversation anymore. We don't want to talk to those people about whatever it is they're reaching out for us to do and explain why we can't do it again. And then that frustration level of not being able to connect a lot of times, of them not being able to understand, and then ourselves feeling misunderstood because a lot of the times we can't come up with the words. I mean, it is super difficult to explain to somebody who has not lived with temporomandibular joint disorder how invasive it is into your life. The same with the millions of you dealing with back pain, facial pain, MS, fibromyalgia, lupus, endometriosis. It goes on. And we just don't want to have those conversations again. That and the people around us a lot of times just can't understand it anyways. So we just pull back into ourselves and don't have them. For me personally, and then real quick, depression in itself and situational depression too, both cause us to isolate because of course they do. We just don't want to be around people. I mean, that comes from all kinds of things, which I'm about to get into in just a second. Patience is the last one. We run out of patience with those around us and the system that makes it so hard to find effective management of our pain. We run out of patience and we just start going off on people. And so a lot of times, rather than doing that, we just pull back into ourselves because we don't want to take it out on those around us. And then with the depression, that's what I've been dealing with, situational depression mostly. There is a difference between the two, like general depression and situational depression. Situational depression has a lot of characteristics like PTSD. And yes, that we can and do often have PTSD from these things. And I'm going to get into that in another video. But it's very similar in a lot of ways to PTSD in that it is triggered by certain memories, events, and things like that. And what's gotten to me recently is it's the 12-year anniversary just about of me dealing with these issues. I've been living in basic constant pain for the last 12 years. And then I start thinking about all the things that took from me, including a woman that I love very much. And then, not long ago, about 2.5 months ago now, almost 3 months, the anniversary is coming up, the friend that helped me come up with this idea and that we worked on this to launch together ended his own life. And so you have all these things coming together for me personally right now that caused me a lot of depression from those situations and memories. And then on top of that, I've had a feeling of just like general purposelessness for the last 10 years, all come crashing down on me. And that's the last thing I was going to talk about. We can feel like we lack a sense of purpose. And we all absolutely have purpose, and there is always a way to find purpose in our lives, even if that thing that we were committed to and we felt like gave it to us is no longer an option. There are other ways. For me personally, it's this. I am committed to this. I'm committed to Chronic Pain Warriors United and fighting as hard as I possibly can with the time I have left and the mobility of my jaw to speak and things like that for reform and change for people like us. Because looking back on those last 10 years and all the people lost and everything that has been destroyed and the level of destruction in our healthcare and everything else, it drives me crazy sometimes knowing it was all preventable. And so all those things came together with me. I'm just using this as an example, and I'm very sure that the same thing happens to a lot of you. All these things came together causing depression and causing isolation. I was down. I don't want to be around anybody. And so I intentionally pull away and isolate myself. And sometimes, just so loved ones who are watching this know, that's needed sometimes for people like us. Our social batteries and our ability to do these things drains very quickly. And sometimes we just need to pull away and have our own time. But sometimes, like I said earlier, it's other stuff going on and general depression and all those types of things. So it can be kind of hard to tell the difference between the two. So I will say this, it's on us when a family member comes asking, hey, are you okay? Things seem a little bit different the last few days. It's on us to tell them, no, things aren't okay, but it's because of this. And if you're not self-isolating just because you need to recharge or whatever, and you're having other mental health problems going on, and they're reaching out to you, then say so. Because that can be a path to connecting, them trying to understand where you're coming from. And that can also help with all kinds of things in being able to start those conversations about your mental health in the first place. Because we don't like to talk about it. It's something that we very rarely bring up on our own. And even when others ask us, we don't like talking about it. But if you're struggling and a loved one comes to you and asks you, and you're not just recharging your batteries and going through, your own time where you need to be alone, it is incumbent on us to say so, because they're not mind readers, right? They can tell something's wrong, but they don't know what. So that's really important. Don't just sit and wallow in that, especially if you have loved ones that are wanting to help and reaching out. The better we communicate and the more we can try and show them what we're going through, the more they can understand and the more they can try and help with all of these issues. So again, it's incumbent on us to say, yes, I'm okay for the most part, but I'm just having these issues and I need to recharge my batteries. Or to say, no, things are not okay. I'm having some real problems with my mental health and I think I need some help. Either one, but it is kind of incumbent on us to say either one. And self-isolation can be very detrimental to our lives if we take it too far. That's about all I've got to say on it, really. I don't want to keep rehashing, but when we take it too far and go past a place where we're not just like I say, recharging our batteries, if we're just sitting in it and wallowing in it, that's not a good place to be in. And one way to start that I use to sort of start getting back into the groove and things is start with something small. Just start with having a conversation with somebody, or maybe putting up clothes in your room, hanging up things. That's what I was doing this morning, Monday morning. And, I don't really want to be making these videos right now. I still don't really have any interest in talking to people. But I need to make those steps, and I need to start putting myself back into situations for, all of this. Because it can be easy to get into a rhythm of just isolating yourselves from people and cutting people off. And that's not what we want to do, right? So anyways, if you know what I'm talking about, and I imagine the vast majority of you do, get down in the comments, let us know. Give any advice you think that I'm leaving out, anything that you think that people could use that will be helpful to others, please. We want to hear it, and we want to hear your stories, as I always say. Be sure and hit the like and subscribe button on your way out after you've done the comments. I'm Marlon with Chronic Pain Warriors United. I hope y'all have a great Monday and a great rest of the week. We'll be doing some shorts here on Tuesday and Wednesday, and then probably releasing the full-length video on Thursday. I appreciate all of you. You're all amazing. Be safe. Cheers.